Good evening.
Good evening.
Good evening. All right. So yeah, let's talk NCLEX, right? I hope everybody's here. Now let's talk NCLEX. So passing the NCLEX exam is not difficult, right? To pass is very easy. You just need to understand the principle of the NCLEX, right? NCLEX is not all about question bank. NCLEX is about concept. Now, in order to understand the NCLEX, you need to understand that NCLEX is not testing you on what? General knowledge. NCLEX is testing you on 6 concepts. This way, the NCLEX is able to test to see if you are what? A safe nurse. Now, safe nurse to a lot of people means that we are trying to prevent somebody from dying. No. Safe nurse have to do with the emotional aspect of the patient as well too. The physical aspect of the patient. So it's not only about the patient is dying, safety, the ethical aspect of the patient as well too. Right. So now your 85 to 150 question will test you on internal care and what? External care of your patient. Your internal care is to make sure that the patient is what? Stable internally. Right. Your external care is the ethical aspect of the patient. Right. So now, since you know now that your 85 to 150 question is broken down into 2 parts, you can easily learn the external aspect and the internal aspect. And that way, if you do 70% here, you do 70% here, you pass. And not only you pass, you have the ability to pass the NCLEX exam in 85 questions. Studying is about structure. So if you don't have a structured way for studying, then you are just all over the place. You will mess up and you will be a chronic what? Overthinker. Now, let's get it all right. Now, what's the NCLEX exam? To some students, the NCLEX exam, they will say, oh, it's a license exam. No, because this is the license. This is you. And before you get the license, there's something right here. So the NCLEX is not a license. The NCLEX is a particular bridge that you need to what? Pass before you can what? Get the license. This is you right here. You need to break this bridge to get the license. So now you now need to understand what it takes to pass. Some people feel like to pass, you need question bank, right? Some people feel like to pass, you need what? Content to pass. But question bank and content is not enough if you don't know what the NCLEX is really testing. Now, let me explain the mindset of the NCLEX exam for you. Now, the NCLEX want to see how you can function as a nurse, not a nursing student. They want to see how you can function as a nurse. So remove your mindset from this and start thinking like what? A nurse. The thinking process of a nurse is not difficult, right? It's not complicated, but we tend to complicate it ourselves based on how we think about the exam. So remove tension from your mindset and let's focus on how to think like a nurse. Now, the ability to think like a nurse, you need to think about the 2 things I said, the internal aspect of care and the external aspect of care of a patient. You are dealing with clients. What the NCLEX mean by client is that the patient can be the client, the family member can be the client, the loved one can be the client, anybody can be your client. So client don't automatically mean patient, no. It can be patient, family, loved one, even the doctor can be your client at a particular moment. Any other person can be your client. Right. That is the definition of client by the NCLEX exam. Now, the NCLEX believe that a client will need 8 things. That's what the NCLEX exam believed. The NCLEX exam believed that the client will need 8 things, and they broke it down in the NCLEX test plan. The NCLEX believe that the client will need management of care. This is for registered nursing. But for PN, the NCLEX believe that the client will need coordinated care. Now, there's no difference between management of care and coordinated care. You are just basically coordinating the care that has been done by the registered nurse. That's the only difference between within all the 8 things the NCLEX feel like you will need. Now, the next one is safety and infection control. The NCLEX believe that you will do this when you start working as a nurse. The NCLEX believe that you are going to do what? Health promotion as a nurse. The NCLEX believe that you are going to attend to the social aspect of a client, the social aspect and the mental aspect of a client. The NCLEX believe that you will be able to do basic care and provide what? Comfort. The NCLEX believe you should be able to reduce what? Risk, reduction of risk. The NCLEX believe you should be able to handle what? Pharmacology. Now, these aspects for the PN, right? But the NCLEX believe that not only the RN should be able to manage pharmacology, they should also be able to manage the parenteral aspect as well too, therapy, right? So both PN RN for this and RN for the parenteral aspect, because this is your IV. This is just for the RN and not for the PN. Now, the NCLEX also believe you should be able to do what? Physiological adaptation. Physiological adaptation. This is keeping your patient safe. Now, all this information right here, right, is the aspect of care that the NCLEX wants you to perform. Now, we have 8 of them. 1, 2, 3, 4, 5, 6, 7, 8. Now, these 8 contents, the NCLEX tests 6 concepts in each of these contents. This 6 concepts is how the NCLEX tests you to be what? A safe nurse. So if you don't know these 6 concepts, you are gambling your exam. If you don't know these 6 concepts, you are gambling your exam. Now, what are the 6 concepts? The NCLEX wants you to know the principle of caring. 1, the NCLEX wants you to know clinical judgment. The NCLEX wants you to know communication and documentation. The NCLEX wants you to know culture and spirituality. The NCLEX wants you to know nursing process. And lastly, the NCLEX wants you to know teaching and learning. So these are the concepts tested on the NCLEX exam. So every question you answer on the NCLEX exam, right, is you can easily interpret the question when you understand all these concepts. All your 85 questions. Let's say you finish your exam at 85 questions. NCLEX tested you on all these concepts. You don't just know because you don't try as much as possible to understand the NCLEX exam. Instead, you tried to only understand question bank, maybe question. Now, trying to understand question on the NCLEX exam is like trying to climb a ladder, and instead of starting from the first, you just immediately move all of a sudden to this area. Now, you can't survive it because it's not possible to just move all the way from here to this place. There are some things that you've missed that's not making you to understand the question. That's the main reason why we think nursing, NCLEX question, every answer are correct or something like that. No, because you are looking for wrong information. NCLEX is not making you to look for wrong information. NCLEX is making you to look for wrong principle in the option, because every option are written in form of care. Now, you now need to figure out what is the wrong thing that is there, not the wrong information, because the statements are not totally wrong. There's just something wrong that is related to a certain principle that you need to think. Now, when you're answering question, and everything else fall under what? The principle of care. Now, I'm going to show you a lot of stuff. Now, knowing that, what you need now, after understanding the NCLEX from all my breakdown, you need two things. You need the NCLEX test plan, and you need the NCLEX what? Practice analysis. Now, this practice analysis include what? The knowledge statement NCLEX wants you to know for the exam. This include the content. Now, if you go on the NCLEX exam and you are saying, oh, I don't know the NCLEX is going to test this, I never knew the NCLEX, it means you've not gone through the NCLEX test plan, or you've not gone through the practice analysis. Because the NCLEX exam is not written, it's written by human, right? But everything has been programmed into what? The computer system. So now, everything on the test plan and the knowledge statement is generated to you on the day of your exam using this computer system through the CAT. Now, the CAT will scan through the test plan and the knowledge statement. For the test plan for RN, right, we have 146 content. For the knowledge statement, we have 338 knowledge statement. For the PN, you have 150 plus content, and then you have 280 knowledge statement. Now, this CAT is going to scan through this in order to give you your question. So there's no how the computer system will give you anything that is not on the test plan. So when students say, oh, and I do not, there are some questions I'm not familiar with, I'm always surprised, because there's no how you cannot be familiar with your question. The only thing is that you don't understand the principle of care, so you are thinking wrongly. I've seen a lot of students in my 2 years coaching experience thinking about surgical procedure, and I will be like, are you the doctor? Because the NCLEX said you should know your scope of practice. Principle of care. As a nurse, you are working with a lot of people, but you need to stand to your role as the nurse. So anything that is not related to you, anything that is not a nursing principle, procedure, or something you need to get involved, don't think about it. They are only trying to describe the care situation that you are, the kind of care you are trying to do. When the NCLEX is telling you about surgery, the NCLEX is not testing you on the surgery. The NCLEX is testing you your role as a nurse in regards to a patient that is undergoing surgery. And your role as a nurse is pre-op, post-op, and monitoring for complication. This is only what the NCLEX will test you. So when the NCLEX is testing you about surgery, this is what the NCLEX is testing you. I don't care the kind of question bank you have been answering. This is what the NCLEX is testing you, your role as a nurse. Some question bank will make you start attending to surgical situation. I'm surprised. That's not how the NCLEX work. So in order to practice right and pass the NCLEX exam, you need to focus on the NCLEX document, not question bank. Yes, question bank tests you on knowledge. Question bank don't test you on concept. Because of question back testing your knowledge, you need to know a lot of information. But concept, you just need to master the six concepts. That is it. That is what you just need to do. Now, once you are done with that, you know the knowledge statement. Now, that is 75% of the work done. You are left with 25%. 25% is now building what we call focus, elimination, and then selecting the correct answer. That is just what you need. But now, the thing you need to understand about NCLEX question is that NCLEX question come in structure. Right, some people don't know that. Your NCLEX question is just like this. Now, this part is your body. This is for you. This part is your stem. This is for the examiner. And this part is what? Your answer keys. Right? This is to give you extra understanding. Now, if you miss out on the process, and most students just like to read all the question in a rush, this, and they are here. They will not be lost here. They will be going back to the question 2, 3, 4, 5 times because they have not created a certain understanding. If you follow the process of understanding the body before you move to the stem, right, and then the answer key for extra understanding, you will not have to read the question 3, 5 times. If you are reading your question 3, 4, 5 times, you don't understand the NCLEX. You are still answering question like a nursing school student. You are not yet answering question as a nurse. Once you are able to master the aspect of understanding the question, then you want to build what? Your focus. NCLEX is not about every statement. NCLEX is about one error the nurse is making that will stop that nurse from being what? A safe nurse. That is what the NCLEX is all about. So that error, you need to figure it out. But that error must be related to the certain concept you are answering. That way, you understand the kind of answer the NCLEX is wanting from you. Right. Now, I'm going to stop sharing now and let us do some practice questions. This is how most students read their question from experience. Now, I hope everybody can see my screen. This is how most students read their question from experience. The nurse is assisting with the admission of a client who is scheduled for a colon resection. Which of the following statements made by the client would be most important for the nurse to clarify? 1, I have urinary incontinence when I sneeze. 2, I had successful cataract surgery 2 years ago. 3, I take acetaminophen for occasional headache. 4, I usually have few glasses of wine in the evening. They will go through the option. They will still go back to the question again. They will say, which of the following statements would most important for the nurse to clarify? Okay, clarify. So what you are trying to tell me is that you went through this question, right, the first time, you did not even pick out the valuable information to get the answer. So why the rush then? Then they're like, okay, number 1 is not safe. Number 2, cataract surgery. I know you don't understand the question that way because you are not thinking like the way a nurse should think, or you don't even understand the question. Now, if you've not created understanding of the question, you will not be able to answer the question correctly. That's why the principle is there for you to navigate the question. The first part of the question is the body. And this body is for you. This part is the stem, and this is for the examiner. This part is what we call the answer keys. And this is to give you what? Extra understanding. Now, if you've done 75% of the work already, you can be able to understand this part. Now, 25% of the work is this. 75% of the work is here. 25% of the work is here. Now, this only can make you answer question even if you don't even understand anything. Now, the body is for you, right? That's where you try to know your role. Now, they said the nurse is assisting with the admission of a client who is scheduled for colon resection. Now, I noticed that, this kind of care I'm trying to give, it involves what? Surgery. The NCLEX will not test me on what? Surgery. So what will the NCLEX test me? So what is my role when a patient is scheduled for surgery? My role is what? Pre-op, post-op, monitoring for what? Complication. That's the principle. Now, if you see 10, 20, 30, be it all your 85 question testing you on surgery, the NCLEX is never going to test you on the surgery. Never. The NCLEX is only testing you on these things. The reason why you don't know is because you are always carried away with everything in your question. You don't even utilize what your scope of practice. You don't answer question as a nurse. Right. You don't answer question as a nurse. NCLEX is not about knowledge. NCLEX is about principle and concept. If you don't know the principle and concept, you will be lost. You will end up complaining. You will end up being frustrated after taking the exam. You might end up passing the exam, but you'll be frustrated. The only thing that will take away that frustration is when you automatically see that pass. But before you get that result, you'll be frustrated. But there's still a way you can practice for the NCLEX or study for the NCLEX exam. Even while you are waiting 48 hours for your result, you are 100% confident that you pass. So how do you want to pass the NCLEX exam? Today you will decide. Now, understanding this, I already understand this concept. Now, I've given you one concept right now. Anytime the NCLEX is testing you on surgery, the NCLEX is not testing you on that particular procedure. So stop thinking about the procedure. It's not your scope of practice. The NCLEX is testing you. What would you do for the patient? We do three things. Either we are doing pre-op care, post-op care, monitoring for complication. Now, it's not for you to now decide what are we doing in this question. The question said the nurse is assisting with the admission of a client. So this is during admission. Can we do post-op care during admission? Obviously, no. Can we monitor for complication when the surgery has not been done? No. So the NCLEX is testing you on pre-op care. So now, we understand now from the body of the question, which is for you, that you are taking the exam, that the NCLEX is testing you on pre-op care. That's how the NCLEX wants you to interpret the question. They want you to create the understanding from the body first before you come to answering the question, because this is now the question on the exam. This is the real question. The body of the question is not, the body is not your question. The body is just a scenario to tell you what is going on, the kind of care the NCLEX is placing you. The NCLEX will place you in 85 different aspects of care in order to test the 6 concepts. So your question 1 will test you on a certain scenario. In this particular scenario, we are assisting in the admission of a client scheduled for colon resection. So think as a nurse. All right, what am I doing here for the patient? Obviously pre-op, because yes, the doctor wants to do surgery. I need to get everything ready for the doctor. Pre-op care. Now, the examiner will now ask you the next question. Now, the examiner is asking you right here. The examiner is saying, which of the following statements by the client? Now, where are the statements? These are the statements. The client made all these statements. Statement 1, 2, 3, 4 would be most important words to clarify. Now, certain keyword, we don't understand it. I've seen a lot of people saying keyword out of their mindset. Keywords, you don't say it out of your mindset. You say it out according to the NCLEX understanding, not mindset thinking. The meaning of clarify is that we are not looking for wrong answer. We are trying to ask further more question. That's the meaning of clarify. I hope we're on the same page. Clarification is we are not looking for wrong answer. Some people think we are looking for wrong answer or we are looking for problem. We are not looking for problem. Clarification don't mean there's a problem. Clarification is that we are trying to find out if there's going to be a problem. So now when you are thinking, you are saying, oh, a patient with urinary incontinence, oh, that's a problem. Then I know you don't even understand the principle of what? Clarification. What are we thinking about? Pre-op. And we're thinking about clarification. Clarify. Now you need to understand what are we clarifying in regards to pre-op, but you need to understand what pre-op is all about. So if you don't know what pre-op is all about, then that's when it becomes a problem. But good news is on the test plan that NCLEX will test on pre-op care. So understanding that the NCLEX will test on pre-op care, you should have even done your studying, your reading about pre-op to know what pre-op care is all about. So when you know what pre-op care is all about, to answer the question is not difficult. Now, you understand that we need to clarify something about the pre-op care. This is the client statement. Now, we want to know the focus thing that we are clarifying. Now, all these statements is what you see, but the NCLEX just see one particular thing in each of these statements. You see everything, but the NCLEX just see one particular thing. That's what we call focus. As a nurse, we look for problem. We don't look at the statement. We look at what's the problem or the issue with the statement that is made. Right here, we want to clarify something. Now, look at how I'm going to go through the question. Now, they said, I have urinary incontinence when I sneeze. Now, a lot of students are thinking about, oh, the patient sneeze, they have urinary incontinence. Remember, we are trying to treat this patient problem. That's one. Two, we are doing pre-op care. We are not thinking about treatment. Pre-op care don't involve anything treatment. So why are you thinking about treatment? Because pre-op care just involve special things you need to do to make sure the patient is ready for surgery. It is all. So now, the NCLEX is trying to send you a particular signal. That is one. The NCLEX is trying to tell you, this patient is bothered about what? Their urinary incontinence. Now, as a nurse, during pre-op care, we do catheterization, right? We insert urinary catheter. So now, I'm trying to clarify to see, based on surgery, right? I'm trying to see if this is going to be a problem to the surgery. Because they say if they sneeze, they are going to pass out urine. Now, I know as a nurse, we catheterize the patient, right, before surgery. So now, I already know this patient will be on catheter. Not only they will be on catheter, they might not be able to sneeze because they will also be on what? General anesthesia. So how would they be able to sneeze? And even if they sneeze, right, probably maybe they are not on general anesthesia, they are on local anesthesia. Even if they sneeze, they are on catheter. So it's not going to be a problem to the surgery. So there's no need for me to clarify nothing here because this is not going to be an issue to the surgery. Now, how am I able to answer this question? Because the urinary incontinence, the NCLEX is indirectly testing us to know if you know that during surgery, we always catheterize the patient. That's what the NCLEX is trying to test you. But you might be all over the place because you want to find problem. You don't understand the concept. Now, I had successful cataract surgery 2 years ago. Now, the NCLEX, during pre-op care, we always used to ask patients, have you had the surgery before? And patient might say, no. Then we move on to next question. Now, if you ask a patient, have you had the surgery before? And they say yes. The nurse want to find out if it was successful or not. If the patient say the previous surgery was not successful, then we try to clarify what is going on. But in this case, the patient said it was successful. I don't know why a lot of students are thinking about how is cataract. I've seen students trying to say, how is cataract surgery related to colon recession? I'm like, you are not a doctor. Why are you thinking about all these things? Only what the NCLEX is testing you here is successful. That's all. Successful, yes, let's move on. We don't need to clarify. That is what NCLEX is testing you, not cataract surgery. You are not the doctor. Why are you thinking about it? Now, another thing we do when it comes to pre-op is that we do what we call medication reconciliation. That's when you try to see the kind of medication the patient is using during before surgery, because we want them not to use some medication before surgery. If I say we should list, I know one of the top medication students list all the time is anticoagulants, but there are a lot more. Insulin, antihypertensive medication. We stop this medication before surgery. But one medication that we don't stop is this medication. So the NCLEX is not testing you about occasional headache, but a lot of students are thinking about occasional headache. The reason why you are thinking about occasional headache is because you are trying to fix a problem. Clarification is not fixing a problem. And during pre-op care, we don't treat. We are not trying to treat. We are not trying to fix a problem. So why are you thinking about all this? Let me repeat again. Now, clarification and pre-op care, you need to understand what is going on in pre-op care. The nurse don't treat during pre-op care. True or false? True. Now, clarification is not about treatment. Clarification is to find out more information about what is going on. But clarification can be anything. We clarify medication order, doctor's instruction, or any other kind of thing. But in this case, the clarification we are doing, we are clarifying it in regards to pre-op care. So we are thinking clarification in regards to pre-op care. So we need to look at what is right here and ask ourselves, what is related to the kind of care I give to the patient that the patient is saying all this? Oh, urinary catheter is related to this. Oh, the patient have urinary catheter. Oh, not a problem, because the patient will definitely be on urinary catheter. See, as I think as a nurse, okay, had surgery. Oh, successful. Okay, not a problem. The surgery was successful. That is not a problem. So this can be out. Okay, I take acetaminophen. Oh, acetaminophen. Yes, they can use it in as much as not anticoagulant. Yes, they can definitely use it. Not a problem. Okay, I usually have few glass of wine. This is the issue right here. Oh, what kind of glass of wine are they using? Is it alcoholic? Because we always used to tell patients not to take alcohol few days before surgery, because it can cause issue with the sedative agent we use, that the patient, it will be difficult to bring back the patient to functionality, like bring them back. Obviously they are not dead, but trying to like remove the sedative agent that gets them to be unconscious for a while, it will be difficult. So this is where the nurse is going to clarify, because right now the patient is not stating the kind of wine. We have non-alcoholic wine, we have alcoholic wine, so we don't know what kind of wine the patient is using. That's why we want to clarify to know, oh, it's not alcoholic. That's why I want to clarify. Right. So that is how to answer NCLEX question. You need to understand the concept. And the funny enough is that NCLEX tests this concept over and over again. Tomorrow, right? People that might take NCLEX exam tomorrow might not see colon recession and see another thing. They might not see any of these options. They might see maybe some of these options or additional option. But the concept is not changing, that this is a pre-op care question. So when you are trying to do 2,000 questions to feel ready for the NCLEX exam, to me, I count that as a waste of time. Why? Because if you pay attention to this one concept, that if you study today, probably you might forget it tomorrow. You need more days to study it. Why not just pay attention to mastering the concept? So that when you see the concept, you don't need knowledge of the question. You don't need to have seen the question in your program before. You only know the concept and you will answer 20, 30 of the same question 100% correctly all the time. NCLEX utilize concept. So once you know one concept, you can use that one concept to answer. You don't need 1,000 questions to practice. Concept. Now, that is one concept. Right. And this one is surgical concept. Now, I've given you that. Now, what you now need to know is, what do we do during pre-op care? What do we do during post-op care? And what kind of complication do we monitor? Now, a particular student asked me a certain day, she was like, oh, but if I want to know the complication, I need to know all the whole surgery so that I know the complication. NCLEX don't want you to know all the whole surgery to know complication. The complication are the same. The complication the NCLEX tests you on are infection, bleeding, right? They are four in number, right? There's one that starts with E. I don't really know how to pronounce that. Right. These are the complications the NCLEX test you on. Infection, bleeding, about it. Let me look that up real quick. Okay. Evisceration. All right. So yes, these are what NCLEX just tests you, basically. Infection, bleeding, evisceration, ABC. That's all. For any surgical condition, I don't care, name it. This is what the NCLEX tells you for complication. Post-op care, yes, post-op care is specific to the surgery, but you don't still need to know the surgery. You just need to know the body system that was operated on. Now, if you look at this particular surgery, you can know what body system was operated on. You know this is a GI surgery. Why? Because it's talking about colon. So what kind of care do you give to the colon? To GI. That's what you are thinking about. So instead of learning 200 surgical condition, you just want to know how do you care for each body system after surgery. Now, you will learn how to care for the neuro, like most especially neuro, the kind of care we are trying to monitor for level of consciousness. So you need to know all those things we do, right? If it is the respiratory system that the surgery was performed on, you do care related to respiratory system. It's not difficult, right? If it's the GI, you do. That's when you say, okay, we are trying to look for bowel sound. That's why most time some people will say, oh, paralytic, ileus, all those kind of complications that can show maybe there's a complication, bowel sound is absent, right? Maybe patient has not passed stool, constipation, all that kind of stuff. There are different kind of bleeding. They are related to that particular body system. Right, so to know that aspect is not difficult. Pre-op is general as well too. There's no different pre-op care. Right. There are general post-op care that are not related to body system, such as you must ambulate patients, right? You must do deep breathing exercise for patients, splitting, all those kind of stuff. They are general. Right. Monitor for pneumonia. Pneumonia is also part of the complication. DVT is also part. General this, but it's related to circulation or the breathing airway, pneumonia, DVT. I'm just adding it so that you know, because some people might not know it's related to the breathing. Pneumonia is related to breathing. Circulation is also the DVT, right? That's why I'm just adding it, right? Because they are all together. They are four, right? So yeah, that is general things you just need to know, and you'll be able to answer surgical questions. It's not difficult. You just need to just follow the process. Now you can choose to learn it this way, or you study 200 surgical condition. Now let me walk you through another principle. Now, on the NCLEX exam, NCLEX wants you to be able to identify your category when you're answering question. Now, NCLEX wants you to understand the kind of question you are answering. Now, because the moment you know the category, we know we have different 8 categories, right? We have management of care or coordinated care for PN, safety and infection control, health promotion. Now, if you are used to the test plan and the knowledge statement, you already know the category of question you are answering. Remember, I said the first part is your body, the second part is your stem, the last part is your answer keys. Now, in order to know the category of question you are answering, you can either know from the body, the stem, or the answer key. Right now, they said the charge nurse in a long care facility has been advised about the following assigned clients. They are only telling me about clients, charge nurse, and I know the charge nurse is definitely going to give me tasks to do or something like that, or decide what we are going to do. Right, but it's not telling me about the question. So I need to read the examiner question to understand more again. The charge nurse should assign the only private room. So the NCLEX is testing you on the principle of private room. So what is the principle of private room? Is it that a patient is causing the most problem, we want to put them in what? A private room, or we are dealing with infection and want to put the most contagious patient in what? The private room. These are the 2 principles related to private room. So now if I look at my option, is this related to mental issue or infection? These are related to infection. So I need to apply the principle of infection to what? A private room. So what's the principle of infection to private room? Airborne first, followed by immunocompromised patient second, droplet third, contact last. Now, there's one principle, right, that you need to know when it comes to infection control. Infection control, we do something. When it comes to infection control question, it's different from medical surgical question. That's the reason why you need to know the category, so you know. Infection control question, NCLEX don't ask you to treat. So if you see an infection control question and you are selecting answer related to treatment, you've gotten that question wrong. Yes, it might be TB. NCLEX is not going to ask you to treat. NCLEX is more going to test you on prevention than treatment. So NCLEX is safety. When it comes to infection control questions, this is only when the principle apply. Safety over treatment. NCLEX is going to include treatment option, but the answer is not treatment. The answer is safety first. There's another thing the NCLEX also do. Testing over isolation. We don't isolate without testing the patient. So if the patient has not been tested positive, or maybe we're having false positive, we don't isolate yet. Now we are trying to isolate a patient, right, to a private room. So if you are trying to isolate a patient to a private room, you want to be sure that the test that you are doing is confirmed. Critical thinking. You want to be sure that the test you are doing is confirmed. Now, I can believe that this test is 100% confirmed. This test is 100% confirmed. This test is not 100% confirmed. This test is not 100% confirmed. If this test is 100% confirmed, let us use critical thinking right here. The NCLEX is not going to write positive, a positive here and leave these two ordinary by themselves. NCLEX will just put positive in all of them. NCLEX will just put positive in all of them to make all of them a positive something, a positive something. But instead, the NCLEX is not doing something like that. Instead, there's a two, a positive something, and then two confirmed. So this is a confirmed infection. 1 and 3, they are confirmed. These two are not confirmed. This is how you write a particular test that is not really confirmed. And the reason why the NCLEX is writing it like that is they want to see your understanding about this word, titer. Titer is a test done to confirm if a patient have infection, but it's not 100% guaranteed that the patient have the infection, because it might be maybe they have immunity to this particular infection, they have been vaccinated to this particular infection, previously exposed to this particular infection. So we cannot rely on the titer test. We need to carry out another kind of test to really show us that, yes, this patient 100% have this. So if you see a titer test, it's not 100% positive. We still need more tests in order to say this patient really have the infection. Now, coming back to the principle, testing before isolation. Now, understanding that we need to do testing before isolation, and this is not a complete test, because titer test means that we need to do furthermore tests. Furthermore tests. When the patient show positive, we carry out furthermore tests to be sure that the patient really have the infection. So I definitely know I don't need to be thinking about number 2 and number 3. My thinking is what? Number 1 and number 3. So now I need to now come back to this stage of taking them what? To the private room. Airborne force immunocompromised droplet contact. Right now, am I having any airborne condition right here? No. So airborne can go. Immunocompromised? No. Now, immunocompromised are your patients with kidney transplant, HIV, chemotherapy. Those are your immunocompromised patients. Or maybe they have issue that cause, maybe they are on medication that have caused immunocompromised, maybe lupus, all those kind of stuff. Now, so this out. I'm not seeing anything like that. Droplet, obviously, yes, this is a droplet. So since this is a droplet, number 3 is your answer. You don't need to think too much about it. So that is how you answer private room question. Now, you need to be familiar. In order to successfully answer private room question, you need to be familiar with infections. Now, you need to be familiar with infections that are associated with droplets, immunocompromised, airborne, immunocompromised, droplets, and contact. So that when you come on the NCLEX exam, you are not surprised. You know already this is airborne, available private room. So you know this is the concept you are using based on all these are infection. Right, this is blood. It's not related to anything here. This, yes, airborne, but it's a titer test. It's not 100%. So this is out. This is droplet. Yes, it's related to droplet. Right, this is a virus. Could be in form of the indirect contact, but this is a titer test and it's not related to anything here. So this is out. You are left with what? 3, and that's your answer. Simple concept. Now, your duty now is to go find out those infections related to this. And then when you come on the NCLEX exam, there's no surprises. And NCLEX tests common things because NCLEX is testing you like someone who have 2 years experience. So NCLEX test common things. These are common things. You might not have seen them before because obviously your reading was not directed to that area. But if you direct your reading, you are going to see all this when you are reading. Right. It depends on the content you are using. That's why we always used to say use textbook. But a lot of people don't like to use textbook. That's the problem. They don't like to read. They like all those 12-minute videos, 5-minute videos. So there's little you can get from there. Right. So now, next concept, right, is the concept of physiological adaptation. This is a physiological adaptation question. It's also a management of care question, but we have your condition right here. We have intervention. Now, when the NCLEX is asking you for intervention, now when the NCLEX tell you a patient have hypertension, the patient is stable until they start telling you the problem they have. Now, this patient is stable until the NCLEX start telling you what they have. If NCLEX tell you the patient have Alzheimer's disease, that patient is stable until they tell you what they have. Right. Stop giving the patient problem. If the patient tell you if the NCLEX tell you the patient have COPD, the patient is stable, Alzheimer's disease, the patient is stable, hypertension, the patient is stable. Stop adding problem to the patient. The NCLEX did not tell you you are trying to treat a patient. The NCLEX is telling you you are contributing to the plan of care. So we are only doing plan of care. We are not doing treatment. This patient is stable. Except if the question is telling you they have shortness of breath, all that kind of stuff. That's what make them unstable. Or they are telling you the patient have increased blood pressure. That's what make them unstable. Or they tell you this patient is confused. That's what make them unstable. But the NCLEX is not testing you on treatment. I'm seeing a lot of students, they will start thinking about, oh, what should I know about COPD? What do I remember Rima said about COPD? Waste of time. NCLEX is not testing you about that. When you don't understand the NCLEX, it make you overthink. You are lost in the question. Now, what the NCLEX is only just trying to test you is the principle of care. The NCLEX is trying to test you on intervention. Before we go to intervention, we started with assessment, diagnosis, planning, intervention, evaluation. Now, intervention is what the NCLEX wants you to do. The plan is this. That's what the NCLEX is asking you. So these are the plan. But the NCLEX is asking you, what are we going to intervene? That's what the intervention we're going to give. There's a diagnosis that has already been done. This is the diagnosis. The assessment is now what we want to figure out because we don't know the assessment. But it's possible to know the assessment. And how do you know the assessment? That is when you go through each of the options. Now, in order to create a perfect assessment, a nurse always do assessment systematical assessment in a way that we know the body system affected. So how do you know the body system affected? There's two ways to know the body system affected. Is either the NCLEX is going to give you clue right here, or two of these options will talk about the body system. Now, I'm going to try to so that you can see. Now, if I look at the disease, I'm already seeing pulmonary. So there's no need for me to go through the option to find out two of the options that will tell me about a certain body system. We have 10 body systems. Right. I don't need to look for two options. I know this pulmonary already. Okay, great. Now we are dealing with the pulmonary. So every of my intervention right here, I will be relating them to the pulmonary when I deal with the focus. Now let's go. Now we are dealing with the pulmonary. What is pulmonary? That's also known as your respiratory system. Now look at how we are going to do it. You can see this will not even be a concern on the question. For a lot of students that wishes to say, oh, I'm scared about the NCLEX giving me a particular condition I don't know. It's because of you are thinking like a doctor. We use nursing diagnosis. Nursing diagnosis, we don't use medical diagnosis. So if you are thinking like a doctor, yes, you need to know 200 disease conditions to answer your question. But if you are thinking like a nurse, you don't need to know the disease condition to answer your question. You just want to know the body system and the principle of care. The NCLEX tests you on principle of care. If you don't know that now, know that. Now, you are going to ask yourself, why do we do this? Because it's an intervention, right? Restrict the client fluid intake to 500 ml. Now, if you understand how the 10 body system work, an intervention we do to the 10 body system, you will know that there is no reason we restrict fluid to respiratory system. Yes, we can restrict fluid to a patient with liver issue, cardiovascular issue, kidney, which is the urinalysis or kidney or something like that. Right? These are the only condition we restrict fluid, not respiratory. Respiratory don't have any issue with fluid. So why are we going to restrict fluid? So this answer is definitely incorrect. Now, place the client in a low Fowler. Yes, when we think about low Fowler, we are thinking about issue with respiratory system. But the NCLEX, when the NCLEX got here, the NCLEX changed the focus. The focus now is not related to respiratory. Instead, the focus is related to meal. If the NCLEX is talking about respiratory, yes, we either do low or high Fowler for respiratory. But instead of the NCLEX to test you low Fowler related to respiratory, they change the focus right here to meal. This is what a lot of students don't know about the NCLEX. NCLEX deal with care. NCLEX don't deal with the way nursing school will test you. So you need to pay attention to the question. You don't need to rush through it. You will miss the focus. Now what I need to ask myself, since this is not related to respiratory no more, it's related to me, I need to ask myself, do we do low Fowler for meal? Obviously, no. We do high Fowler for meal and low Fowler for aspiration. Right? When we are feeding the patient, we place the patient high Fowler. And then when we are trying to minimize aspiration, we place the patient semi-Fowler, low Fowler, anything you want to call it. Now, so this is meal time. So we don't do low Fowler, we do high Fowler. So this is wrong as well too. Have I, right from thinking about question one, option one and option two, have I had anything to do with COPD? No. Now, provide the client high carbohydrate and high carbohydrate snack, diet and snack. Now you need to understand what is carbohydrate. On the NCLEX exam, the NCLEX talk about nutrition. It's on the knowledge statement that you need to have knowledge of nutrition. So bad nutrition, good nutrition. This is an example of a bad nutrition. I've seen a lot of students asking themselves, why would they give high carbohydrate to a patient with COPD? And I'm just looking at them. This is obviously a bad nutrition. High carbohydrate. Who do you give high carbohydrate to? Who? The patient is stable. There's no problem with the patient. So why do you want to give them high carbohydrates? Some students will be saying maybe the patient is having issue. Where's the issue right here? I'm not seeing any issue. They show me the issue. Because there's no issue with this patient. So why are we giving them high carbohydrate? This is not a patient that is dealing with hypoglycemia. So why? Do they have issue with low sugar? Or do respiratory issue cause low sugar? I want to know. Carbohydrate, glucose, right? No. The only time we give something high, according to fundamentals, the patient must have deficit of that particular thing. Or they must be so in need of that particular thing before we can give something in high quantity. Now, let us go back. Let us feel like maybe we are thinking about COPD now. For COPD, or let us say we are thinking about respiratory issue. Now, a patient with respiratory problem, they use effort in breathing. So due to that reason, they lost a lot of energy. Right. And in order to fix back energy, what do we use to fix back energy? Calorie. So if it's a patient that's having respiratory issue, I expect to see high calorie, high protein. Energy weakness, high protein, high calorie is going to fix that. So if I see that, yeah, I will say, okay, yes, respiratory issue. Yeah, they might deal with problem with loss of energy if they are using effort to breathe. So yes, that's the kind of option I'm looking for, not high carbohydrate. This is not proper. Right. So wrong. I'm left with number 4. So now if you've done your elimination well, I said this is where you do the 25% work. If you've done your elimination well, you will be left with that correct answer. Me, I don't go for the correct answer, except if I see the correct answer first. I look for the wrong answer before I decide the correct answer. Because it's easy to select the wrong answer than the correct answer. Because the correct answer might not make sense to you. There are a lot of things you don't know in nursing. So don't try to understand every of your options. Try to understand what is wrong. Because the NCLEX believe every nursing student should have the ability to know what is wrong. So that correct answer might not make sense to you, but let the wrong answer make sense for you to eliminate. That's how you approach it. Now, let me do same method again. Right, in form of, I'm doing this job because of some students that feel like they cannot answer questions until they know the disease that is being tested. Now, let's do this particular question, Alzheimer's disease. Now, let us act like we don't know Alzheimer's disease. Remember, this patient is stable. Same concept, intervention, right? Now, we don't know this disease. But now, the first thing I want to know, because of principle of care intervention, I need to know what is going on. Right. Trying to know what is going on. When I look at my answer keys right here, now, like the condition, I'm not seeing any hints. Right. I'm not seeing any hints right here that is telling me the body system that is affected, unlike that one that said pulmonary. Now, meaning I need to switch my focus to the answer key to see two options that will tell me about the body system that is affected. Now, I need to read the option to know what is going on. Encourage the client to reminisce about happy memory. What am I thinking about the problem? Right. I'm thinking about this patient is having memory issue. Before I can tell a patient to reminisce about happy memory, they obviously have memory issue. Confront the client when inappropriate or agitated behavior occur. Obviously, I am thinking about this patient have what? Inappropriate, right? Or agitation, right? Now, this memory is related to what? The neurological system. Agitation as well is related to the neurological system. I don't need to read the other options. I already know neuro, two options. If two options tell you about a particular body system, that means that particular disease condition is related to that body system. You can never go wrong. This is how the NCLEX is programmed. Right. So now, understanding that is a neuro, meaning I am giving what? Neurological care. Neurological care is a lot, right? But we group everything all together if you understand the care of neurological system. So understanding the care of neurological system will save you from studying 100 neurological disorder. I know the care of neurological system, so I don't even need to read disorders. Now, since I've been able to now know the body system affected, now I cannot be able to answer the question. Then now I want to now see what is the patient problem and what is the solution. Now the patient problem right here is that they're having issue with what? Memory. The patient problem is that they are agitated. The patient problem is that they want to what? Reverse their AD, right? They want to reverse their Alzheimer's disease. Now, the patient issue right here is plan for the day. I'm just going to short it like that. Plan for the day. Now, remember we are dealing with neurological issue. So think neurological care. Now, what is the solution? What is the intervention? We are trying to use reminisce, right? We are trying to use what? Confrontation. We are trying to use this medication. We are trying to provide information so that the client can make plan of the day. Right? We're providing information. Now, think about neurological care. Now, do we do this for a patient with memory issue? Obviously, yes. You can see it's one keyword the NCLEX wants you to focus on. Now, do we do this for a patient that is agitated? Obviously, it's wrong. We don't do confrontation in nursing. According to nursing, you don't do confrontation to both patient and staff, so it's wrong. No. Now, do we give medication to reverse? According to the principle of NCLEX, NCLEX want to test you on acute and what? Chronic condition. Now, when the NCLEX is testing you on acute and chronic condition, right? Acute condition, when there's a damage that occur in acute condition, yes, medication can fix it. But when it's a chronic condition, medication cannot fix it. So we don't teach a patient that something will be reversed or resolved. So if you see statement that NCLEX is saying reverse, resolve, it's wrong. So if NCLEX use statement like resolve, reverse, the NCLEX is talking about chronic condition. Don't think it's twice. The NCLEX is talking about chronic condition. And the principle of chronic condition, complication cannot be reversed or resolved. So this is definitely wrong. Right. So this provide the client information about activity. Yes, we want to provide client information, but we need to think about the kind of client that we are caring for. This is a client with neurological issue. Anything can happen. We don't trust them with making care or plan for themselves because it's the neuro. That's where they have their thinking process. If they're having issue with their respiratory system, yes, we can confidently provide them information. Remember, if anything happened to this patient, it's on your license. It's negligence. So for a patient with neuro, the NCLEX expects you to think that, okay, this is a neurological problem. I don't care if it's Alzheimer's. It might be any kind of neurological condition. The NCLEX wants you to think about it. There's that possible chance that this patient might not be able to focus because what we are treating is the neurological system. So they might not be able to focus or do things themselves. We need to assist them because it's the neuro. If it's the respiratory problem, yes, we can give them the plan to do for themselves. It's the cardiovascular, yes, that does not have anything with their thinking process, their neuro, anything. Or confusion level of consciousness, no. So this is not going to be appropriate for a neurological patient. Yeah, it can be appropriate for any other kind of patient with any other body system, but no, not neuro. So I'm left with number one as my answer, which is the correct answer. So now, when I'm answering this question, I never for once thought about Alzheimer's disease. So now tell me, how do you feel you can answer question on the NCLEX exam? You feel you need to know the medical diagnosis. If you think like a nurse, you will answer the question successfully. So for most students that always used to say, oh, I'm scared of seeing a particular disease condition, is because you are trying to know the medical diagnosis. Yes, there's nothing wrong knowing the medical diagnosis if you are ready to do the work. There's a particular textbook that contains all the disease condition, the NCLEX test. Right. There's a particular textbook that contains all the disease condition, the NCLEX test. This is the textbook right here. This is the textbook. It contains all the disease condition, the NCLEX test. Right. So if you go through this textbook, you are ready to read it. It has how many pages? 738. Then fine, yes, you can decide to read every information right there. Contain all the disease condition, the NCLEX test. Mention any disease condition. If you have taken the NCLEX exam one time, two times, if you check here, you are going to definitely see your disease condition. Yes. So you can do that work and go over the disease condition. But if you want to use the principle of care, you don't necessarily need to go over this condition. Right. Now, if the NCLEX is testing me on now this particular condition, the renal phenomenon, I don't need to know about this. I just need the answer keys to figure out what is going on. That is how nursing think. We use what the patient is experiencing to know what is going on. We don't necessarily need to know the diagnosis. So what is going on is going to sell what is happening here. The NCLEX is not selling, testing you on this. Instead, the NCLEX is testing you on a specific body system care. So you are thinking this, but the NCLEX is not really thinking that. But if you know that, you can still answer the question. If you know this, yes, you 100% be able to answer the question, but you don't necessarily need to know it to answer the question. But it's left for you how you want to learn. But yeah, that is that for that. Now, let me go through this question. Now, this concept that the NCLEX wants you to use here is the principle of teaching. Right, thought. Now, remember one of the concepts, right, that the NCLEX test I said earlier on is teaching and learning. The learning aspect is for you, staff education. Teaching is you are teaching the client. Now, there's two scenarios you can see on the NCLEX exam. You can either see that you are trying to teach the client or the teaching has already been done. In this case, the teaching has already been done. Now, the concept behind teaching the NCLEX wants you to know is that for every teaching, there's a problem that we are trying to give solution to the patient. There's a problem we are trying to give solution. Now, this patient is stable, but we talked about a lot of things that can affect this patient, the problem, and we are giving them the solution. Now, when I gave this question to a lot of students, what I noticed they do is that they try to remember everything about multiple sclerosis. I know that. Now, see something. They say, I know that a patient with multiple sclerosis will experience this, we experience that. NCLEX question don't want you to think like that. Everything the patient will experience is already in your option. So there's no thinking you are doing. If you don't understand the principle or the concept of the NCLEX exam, you are going to think about information that is already on the question or bring extra information that is not even the question or needed to answer the question. So if you understand the concept of the NCLEX exam, which is teaching means that each of any provided option already have the patient problem and a solution. You just want to find out what is the problem and is the solution the right solution. Now, this teaching has already been done, even though the teaching has not been done or the teaching has been done, it's still the same problem solution. Now, look at how I'm going to answer this question. I'm not going to think about multiple sclerosis. Let me remove multiple sclerosis from this issue. Now, those people that understand about multiple sclerosis, let them be thinking about multiple sclerosis. We are going to figure out the answer together. Now, multiple sclerosis is out of the way. Now, the NCLEX is asking about teaching. So a teaching has been done. I know a teaching has been done. I'm not there, when the teaching was done, but I would be able to tell you the exact teaching that was done. Now, based on the patient's statement, because the NCLEX is saying which of the following statement by the client indicates correct understanding of the teaching. So meaning there's a problem, right, in each of these, and then the patient is saying the correct solution or the wrong solution to that problem. So I'm expecting to see wrong solution and correct solution, but the NCLEX is asking for the correct what? Solution, understanding. Now, what I need to now figure out is the problem, because if I don't know the problem, I cannot say if the solution is correct or not. Now, the problem for this patient, they said, I will complete all my household chores in the morning when I am well rested. Now, before this teaching was done and this patient arrived at this particular statement, what was the problem? For a patient to say, I will complete all my house chores in the morning when I'm well rested, it looked like this patient have issue with stress. Name it. Maybe you are thinking about stress. Maybe you are thinking about tiredness, right? Maybe you are thinking about weakness. Anything, it's apply. Because why do they need to rest in the morning to complete something? It means that maybe they are dealing with all these things. That is one. Now, two, I have learned how to massage my bladder to help empty my bladder. This is even clear because we know the issue with this patient is that they are unable to what? Empty their bladder. So that's their issue. So teaching now, and I know what the nurse discussed with the patient. And I know that the nurse had discussion with the patient about how to manage stress, tiredness, weakness, emptying the bladder. So these things are the things that you are thinking about, whereas they are already in your option. I don't need to think about that. I just need to look for it in the option. Now, I will take hot bath in the evening to help relax if I had a stressful day. This is clear. Like they are trying to use hot bath to fix stress. So the nurse had so much discussion with this patient about stress, right? Stress here again. Cool. Now I should expect my blood vision to resolve after. So the nurse told them information about blood vision. So these are the patient problem. Now the NCLEX is not testing you about the problem. Instead, the NCLEX is testing you about the solution to that problem. So now that's when I need to figure out what is the solution. The solution that the patient is saying to fix their stress right here is that they want to complete all their house chores what in the morning. Now, the solution to the emptying bladder is that they want to massage the bladder. Now, the second aspect of stress, the solution is that they said they want to take what? Hot bath. Now, the solution to this blood vision is that they said they are going to receive medication for several weeks. Now, I've said this previously before. Anytime you are seeing the NCLEX saying resolve, reverse, NCLEX is talking about chronic condition. You can see this is the second question. And now, even if you maybe doubt what I am saying, think about it. Alzheimer's disease is acute or chronic condition. Obviously, you are going to say yes, it's a chronic condition. Multiple sclerosis, is it acute or chronic condition? Obviously, it's a chronic condition. You can see right here why it is wrong. Because medication cannot resolve or reverse damage that has occurred due to chronic condition. So anytime the NCLEX use this statement, the NCLEX is directly testing you on chronic condition. You don't need to think about it twice. It's the principle of care. Right. So people that overthink, this is your shortcut. Now, just remove this out. Now, do we use hot baths to fix stress? Yeah, if they take their bath, yeah, you can help them feel stress. But the problem right here is that hot is the problem. We don't do anything hot in nursing. This is wrong. We do warm or cool. So hot is red flag. So this is hot. It's just like we don't do what? Confrontation. No, we don't do that. Now, do we massage bladder to empty bladder? Yes, this is a good technique. NCLEX call it the Credel maneuver. I don't know if it's Credel or Creed maneuver. Yeah, NCLEX call it. You might see it like this or massage. They mean the same thing. It's correct. Now, complete. Now, you see, obviously this is the correct answer. Even if I don't read this option, I know true is the correct answer. But let's go over the option. Now, complete all my house chores to manage stress. Now, what's the issue? The patient is having stress. Now, yes, we want to complete all our chores. We want to complete all our chores. But what is the mistake here? The mistake is that we are completing all. And I know some people have talked about absolute a lot. So Sanders talk about absolute a lot of the time because Sanders understands the NCLEX, so she know about absolute. Now, apart from knowing about absolute, let us think nursing knowledge. Right, nursing knowledge, you are tired, and then the next minute you want to do everything, what will happen again? You become tired again. So how are you managing stress that way? By doing everything or doing all. Everything, all is the same thing. Absolute are like your always, never, every, all. You understand? So anytime NCLEX use that absolute, if it's not related to treatment, right? If it's not related to treatment, it's wrong. And this one is related to teaching. NCLEX don't believe in absolute when it comes to teaching. NCLEX don't use absolute to teaching because the other side can also be the answer. It can either be different sides to the answer. So using all is wrong. But aside that, if you think through the option, you can understand that completing all your outsource, even if you've rested for 24 hours, if you come back to complete everything again, you are going to be tired again. So what's the best way? You do pacing of activity. Maybe you do some in the morning, in the afternoon, and then in the evening. So this is wrong. So yeah, two. Now, that's the principle of teaching. You can apply that principle of teaching to every of your questions. You can apply that principle of teaching to every of your question, right? You will always get your question correctly that way. Teaching, whether the teaching has been done or not, it will work, right? So if you want to use that, okay. So let me see. Now, I will talk about the like your clinical judgment is part of the principle of care, which you have your generating, your recognizing clue. You have your recognizing clue. You have your um, par- um analysis of the clue, prioritizing hypothesis, then use H, generating solution, take action, evaluation. Now, a lot of NCLEX program don't even get this process. Recognizing clue, I will see a lot of NCLEX program putting evaluation in this area. Your number one question should be recognizing clue. Your number two should be to analyze the clue. Prioritize hypothesis should be your number three. Generating solution should be your number four. Number five should take action. Number six should be evaluation. Now, a lot of people did not attend the program that the NCLEX did concerning understanding the case study. So a lot of program, because they want to generate a lot of students to purchase their program, they just created something that look alike, but they are not related to the concept. So are you trying to answer prioritization question based on look alike or that test the concept of the exam? That's the mistake. That's the reason why no matter how many case study you practice, you still go on the NCLEX exam, you still feel lost because you don't understand the concept. The concept of recognizing clue, the NCLEX can do it in two ways for you. One, the NCLEX can group it into body system, or the NCLEX might not group it into body system. If the NCLEX group it into body system, yes, it even make more sense because that way you can easily know what body system is affected. You don't need the diagnosis for clinical judgment case study. Now, the body system that is affected only tell you that, okay, we are suspecting a respiratory disorder, right? I don't need to know the diagnosis right here, right? I just need to know what body system is affected. Now, the NCLEX did not group this into body system, so they want you to group it by yourself. The NCLEX want you to recognize problem and what body system is affected. Now, so your number one case study is to find the problem and what body system are affected, because that way you know what you are caring for until the doctor give you the diagnosis. The doctor might give, the doctor might not give. So just know that. Now, the client report nausea. This is a GI problem. Loss of appetite. This is a GI problem. Vomiting, GI. Now, I have more of GI problems. So I feel like the GI is having problem. Now, they are saying fever, right? So if they are saying fever, I might not say, okay, this is looking like what? Infection of what? The GI. Constipation is a GI problem. Makes sense. Now, everything is all speaking GI to me. Abdominal pain, GI. I don't need diagnosis to know that this patient is having a GI problem. We don't need diagnosis right here. Now, look at what the client even stated. The client is also complaining of what? GI issue. And they are saying they got the pain when they got accidentally kicked. So that's a big key for us to think about. They got the pain when they got accidentally kicked, right? Look at the vital sign. The temperature is also confirming to us that yes, it's an infection of what? The GI, right? So the pulse is okay, respiratory rate is high a bit. Take note, the blood pressure is high a bit, oxygen is okay, right? No past history, they have increased BMI. Right, your BMI should be 18 to 25. They drink alcohol. Right, so that's the problem you are trying to figure out. Smoke. So those are the things you are figuring out, the problem. But after noticing the problem, you want to also know what body system is affected. So yes, I've been able to pick out all the problem. And at the end of the day, I know that the GI is the one that is having issue. Now, the examiner is asking you to highlight that require follow-up. Right. So require follow-up is NCLEX telling you to do prioritization. Now, the patient is having a lot of problem that we've highlighted here, but now what is the problem that require follow-up? One, you are selecting the most answer from the body system that is mostly affected, which is the GI. So your answers will be related to the GI. Now you need to know what the NCLEX wants you to highlight, right? If it's on the NCLEX exam, right, you will be able to see what you need to highlight, which is the second aspect like this. Right, you can be able to see what you will be able to highlight. Now the NCLEX made all this area highlightable for you. Loss of appetite, pain. This pain is high, yes, this pain is important. Right. The loss of appetite is definitely important. The temperature is definitely important. The respiratory rate, they're definitely important. Right, this is what we select if you happen to be on the exam, then I'm going to move on. But now I definitely know this is what the GI. I'm not over selecting. If the answer is 5, I prefer to score 4/5, right, than scoring everything. But yeah, if you understand it's a GI, you select answer related to GI. Move on. Now the second aspect is to analyze the clue. Now, when you are doing analysis of the clue, right, you are thinking about what is affected. Now, remember, we are dealing with GI symptom and we are thinking GI what? Infection. Right. So now when you are thinking about those things, that's what you want to put. Now, the NCLEX now selected different problem right here. And the NCLEX is not trying to make a good guess. Are we thinking of bowel obstruction? Are we thinking about appendicitis or are we thinking about ruptured spleen? That is what the NCLEX is trying to tell you when you come to analysis. But a lot of students feel they need to know what is bowel obstruction, what is appendicitis, ruptured spleen to answer this question. You don't need to know it. Two things you don't need to pressure yourself on is scoring everything on forcing yourself to know the disease condition. You can still answer the question based on the patient's situation. This is the patient's situation. The patient's situation describes the problem. Now, appetite issue. Appetite issue is related to what? That's what you need to ask yourself. First, a patient that is having appetite issue, that is a GI problem. So you need to ask yourself, which of these following is a GI condition? Obviously, ruptured spleen, right, is related to the abdomen, but it's not related to the GI things, right? It's more related to the immune and cardiovascular. These are the ones that are related to the GI. So it's likely your appetite will be affecting these two GI. That's how you think. It will not affect this. Now, pain level, the NCLEX is talking about pain. We are talking about GI, but the patient complain about pain. Now, a lot of students will be saying, with bowel obstruction experience pain, with appendicitis experience pain, with ruptured spleen experience pain. The NCLEX said they are experiencing pain here. And this is what we are suspecting based on the symptoms. So we don't need to think it twice. We are selecting all the pain. I don't know if you are understanding what I'm saying. The NCLEX is not difficult. This appetite is GI. So I'm going to relate it to GI, which is this. This is not a GI. Now, pain is general here because they said the patient is experiencing pain. These are the suspect of the NCLEX. Based on what this patient is presenting, the NCLEX is suspecting this patient is either having bowel obstruction, appendicitis, or ruptured spleen. That's what the NCLEX is suspecting. So the NCLEX suspects ruptured spleen because of pain. So it makes no sense you are thinking about if ruptured spleen we have pain or if appendicitis we have pain, because pain is general. The only problem is that you don't know that pain can affect any body system. It can affect the neuro, it can affect the GI, it can affect the musculoskeletal, it can affect any problem. So pain is general. It can happen to any body system. So yes, it's a general answer like that. That's the thinking NCLEX wants you to use. Bowel pattern. What are you thinking about bowel pattern? Bowel pattern is related to GI. This is the only answer that is not GI. So this is wrong. These are your GI. Gastrointestinal symptom. This is your gastrointestinal. This is not related. Simple. Because this is not a GI problem. This is immunocompromised. And cardiovascular. This is your GI. So these are your answer. Simple as that. Now, move on. This is why I always tell students, your principle of answering NCLEX question is based on body system and the principle of care. Now, if you don't know that, you will have to think about disease condition a lot. Now, the third part of your NCLEX is testing you on complication. Now, complication means that the third part, the first one is recognizing clue, analyzing the clue, prioritizing hypothesis. The next is generating solution, taking action, evaluation. That's why I say if you practice with programs that don't follow this principle, even if you practice 50 NCLEX per case study, you will still have problem on the exam. That's why you need to use the NCLEX past question to answer, to practice. Right. So now this is complication. Complication means that based on what this patient is experiencing here, I'm trying to think about it, that what can the patient be having? Like, what is the patient at risk for? Complication means that it has not happened, but based on what this patient is experiencing, they are likely to have it. Now, when I look at this information that the patient is experiencing, is there anything related to what the patient is experiencing that can cause anemia? Obviously, no. So why do I need to think about anemia? Because there's nothing that can cause anemia. What will make a patient have anemia? Loss of blood. There's no anything here that is telling me the patient is having loss of blood, or maybe the patient is having any issue related to anemia or something like that. No, sickle cell, there's no history. Even the NCLEX said there is no past or medical history. So no. So that's out. Now we are thinking about infection. Remember the NCLEX talk about fever. So there's chances that, and this is an infection, there's chances the patient might be at risk for what? Peritonitis. So yes, this is a good answer, right? Septic shock. What will make a patient have a septic shock? That is if they are bleeding, right? Right, if they are bleeding. But right here, I'm not seeing anything that is telling me that the patient is bleeding. The blood pressure is definitely fine. So since the blood pressure is definitely fine, I cannot think about septic shock. Okay. There's another thing we can think about. Okay, I'm just saying something now. The patient is having infection, right? So maybe the infection, if it stay for long, right, we can easily think about septic shock, the infection, right? Because the blood pressure is not low, but infection is there. So septic shock is an infection, right, that have got into the blood. Yeah, so this could be also a possible answer. Now, hypovolemia. Yes, the patient is having nausea, vomiting. Yes, they can lose fluid. So yes, this is a correct risk for dysarrhythmia. This is a GI symptom that we have been dealing with. So how is cardiovascular related? This is a cardiovascular issue. So this is out. GI issue cannot do that. Now, cardiac arrest, this is a cardiovascular issue. We are thinking about GI complication. This is going to be out. So you are left with 2, 3, and 4. Smart. Right. You can see as I'm answering the question, I'm answering the question based on the principle of body system and understanding of labs. I've told a lot of students, when you want to answer a question, you need vital sign, head to toe assessment, labs. I wish you to say that, because these are your principle of care. NCLEX believe for you to care for any patient, you need to have this. These are your two. If you don't understand how to interpret that, you need to start learning that. That will make you answer questions smartly. Now, the next part right here is that they said, okay, a nursing note has been included. Every issue that is happening here, as at 11, was discussed with the doctor, and the nurse is awaiting order. Now, they are not asking you for potential intervention. Now, when you are dealing with intervention is just like how we're answering those standalone questions. Intervention is related to what? Body system. And in this case, it's the GI that we are dealing with. So any intervention that is not related to any problem right here, or the GI, not indicated. Now, clear liquid diet is related to the GI, but you need to still think about it. Do we give clear liquid diet to a patient that is having nausea and vomiting? Obviously, no. Right. Yes, it's related to GI, but we need to know if it is safe to give, because the patient is having nausea and vomiting. We don't want to give anything. We want to maintain the patient what? MPO. Smart thinking. Enema. Why do we do enema? Is this patient having any issue with constipation? I'm not seeing anything that they say they have any issue with. Okay, they said they have constipation. Okay, this is it right here. Now, constipation, so yes, indicated. Now, eating pad to the abdomen, red flag. We don't do this. We don't do that. So not indicated. Right. Abdominal gut measurement. Yes, it's a good assessment. Head to toe assessment. Remember, I said your tools is part of head to toe assessment. Yes, we do this. Right. Abdominal CT scan, yes, we want to do that as well too. So yes, these are your answer. Right. We don't know what's wrong with the patient, so you cannot start applying eating pad to the patient just like that. Right? It's a red flag. Because we don't, anything might be there, we might rupture or something. So yes, that is your answer. Now, the fifth part, we have done the generating solution. Now we want to take action. This is your next question on taking action. Now you're taking action. I've said a lot of things, right? They said nursing notes from 12, right? Diagnostic report result. Now see nursing notes from 12, they did the CT scan. Now from here, you can easily tell that, oh yes, we were correct about selecting CT scan, right? They gave fluid, right? Patient got relief from pain, vital sign, only the pulse is high, blood pressure reduced a bit. Now the physician note about the status, right? Okay. Let's see what the laboratory is talking about. The laboratory is saying they have appendix. Now you now know the diagnosis, because you don't need to think about the diagnosis right from the beginning. Now the NCLEX has given you the diagnosis, and if you notice, we have been doing so great because we did not select any answer that is telling us anything otherwise. We eliminated other things that were related to distraction because we were focused on the GI problem. So now the NCLEX has revealed to us that this patient have what? Appendicitis. Now, we want to take action based on appendicitis. Now, the NCLEX is asking us, what are we going to do? Right, for a patient that have what? Appendicitis. Right, the first thing, what should we insert? Right, remember we were talking about don't what? Remember we were talking about don't give clear liquid because we need to keep the patient MPU. You see, it's smart. Now, I did not think about appendicitis. I thought about vomiting, not to do that. Now, first thing we definitely do is to give what? NG2. Now, next, because we are dealing with what? Infection, we are going to give what? The infection. Right. So, to fight the infection. So, yeah, that is pretty much. Oh, sorry, I selected the wrong answer. This is the answer. Anti-infective. Yeah. So yes, that is the answer, not pediatric, because we are trying to fight infection. This is just going to remove the fever, not totally going to fight infection, but this is going to fight infection itself. Right. So yes, we are done with the take action. And the last aspect is to, okay, they asked us last thing. Now they're asking us, when should we prepare a patient for surgery? Now I love a particular response a particular student made. Now, when we are trying to prepare a patient for urgent surgery, if the NCLEX line up time like this, we are looking for the lowest time. Right, so 6 hours, right? Because if you are doing a surgery and the surgery is emergency, we don't waste time. We don't want to do 8 hours. We don't want to do 24 hours. Because patient can die or not. So obviously the NCLEX is just trying to test you on the principle of emergency, urgency. Urgency, we don't waste time. So if you don't need to know what time, just think about it. What are we doing? It's an emergency situation, surgery. When do you prepare? 6 hours. Right, following through, the patient is not coming from their home. They are already in the unit when we discover the issue. So emergency surgery, the lowest hour. And you're going to find that very soon. So if you think it's 8 hours, 24 hours, wait, and I will show you it's not. Now, if you notice, the NCLEX said they included what? Another nursing note. Now, let us see the time they took the patient to 18 o'clock. Now, look at what the NCLEX said. Client transported to the operative room for appendicitis. Now, the last time was 14:15 p.m. Now, this is 18 p.m. How many hours is in between? This is 4 hours, right? So if you selected 8 hours, wrong. If you selected 24 hours, wrong. Because it only took 4 hours to take the patient what? To the operating room. So if you selected 6 hours, yes, correct. to prepare the patient in the next 6 hours. So that's how you know if you are right. When you're answering your NCLEX question, you would definitely be seeing the sign that, oh yes, I selected the correct answer, I selected the correct answer. Now, the last part is evaluation. Now, for your evaluation, all you just need to look at is what is the problem, what's going on with the patient, right? And be able to select your answer. Right, they said, which of the following indicate that the patient is progressing? Right, select all that apply. Now, you are going to see what is going on right here. Now, the patient can drink clear liquid. Before, they were not able to drink clear liquid. So, this is correct. Borderline abdomen is a red flag. So, this is not a sign that the patient is progressing out. Rebound tenderness is not a sign of progressing, that is out. Using insensitive spirometer, which is here, this is correct. That's a good thing. Diminish bowel sound. Yes, something that will occur after surgery, but it does not mean the patient is progressing. Performing leg exercise. Yes, if they're able to perform leg exercise, is something that they are progressing. So the answer is 1, 4, and 6. So that is how you answer case study question. And you can answer case study question this way. Right. Yes, if I'm not sure about my answer, I'm sure that I'm on the 90%. So, but yeah, if you do it like this, you kill the NCLEX exam case study. So yes, that is that for case study. Right. So now, principle of communication. Let us talk about principle of transfer. Now, when the NCLEX is testing you on transfer, right, it's on the NCLEX exam. The NCLEX wants you to think about two things. The NCLEX wants you to think about transfer to because of further care or to make bed available. When the NCLEX is testing you to make bed available, they want you to send a stable patient, but further care on stable patient. Right. So this is to make bed available. So we are looking for what? Stable patients. Now, the mistake with a lot of students is that you always like to use the patient diagnosis. NCLEX don't prioritize using the patient diagnosis. Right? They don't use the patient diagnosis to prioritize. It's what they are experiencing that tell you if the patient is stable or not. Don't make that mistake on the exam. All these are not the reason why you are prioritizing. A patient is having diabetes don't mean that they are not stable. It's until their blood sugar is high, that's when they are unstable. A patient is hypertension that have hypertension don't mean they are not stable. It's until they are unstable. So
now connected to laptop B5 gigahertz.
Can't hear you.
can you hear me?
Yes.
Yes, we can hear you.
Yes, we can hear you.
All right, great. Now, so patients that is stable. So I want you to understand the principle of NCLEX. Like now, see what the NCLEX is doing. NCLEX is telling you their condition and telling you what they are experiencing, their condition, what they are experiencing, their condition, what they are experiencing, their condition, what they are experiencing. It's only when the NCLEX tell you all this that the NCLEX is trying to tell you if they are no more stable. Right? This is what the patient diagnosis is all about. The NCLEX will never ask you to prioritize based on their diagnosis, but the NCLEX will ask you to prioritize based on what they are experiencing. So to know a patient that is stable is to ask yourself, okay, now, yes, this patient have diabetes, but are they stable? They are having this patient is not stable. They are having insulin, not stable. Hepatitis C, they having no fever, 24 hours, yes, they are stable. Fracture, external, not stable. Now, let's talk about why they are not stable. This patient, want to transfer them to another unit. We want to transfer stable patient. Yes, they had the surgical procedure, but they're having this going on. Can we maintain this in the maternity unit? No, this have to be managed in the surgical unit because the surgical procedure. Now, the NCLEX is using a particular word right here that tell you this patient is just receiving what? Their insulin. So this patient needs further more assessment. This patient is not yet stable because obviously this patient can have hypoglycemia in the process. So the patient is not stable. So that patient you cannot send. Now, but this particular patient is having a certain infection right here. And the NCLEX is not telling you, but in 24 hours, they don't even have fever, which is a sign that the treatment has been completed on this patient and this patient is free from this problem, right? Infection. So they are definitely stable, yes. Now, this patient is having this surgical and they are having external fixation. The external fixation cannot be maintained in the maternity unit. It must be maintained in the surgical unit. So wrong to transfer. This patient is unstable as at yet. Needs further monitoring, but this patient is afebrile. The principle of a patient that is stable is that their vital signs should be within normal range for 24 hours. So if you are looking for a stable patient, just look for the vital sign and find out if it's been stable for 24 hours. NCLEX wants you to know medical terminology. So this is a certain medical term. So the NCLEX don't want to make this question cheap by saying no fever. Instead, they just gave you a febrile for you to think about it, because it's on the NCLEX exam. You need to know medical terminology on the test plan. So that way you know the patient is stable. Now, delegation, right? You can have a delegation question like this, but the NCLEX tests you two things about delegation. One is either they test you to assign or they test you for best direction. Now, when you are dealing with assignment, the NCLEX is trying to tell you, think about the task and the client what condition. But when the NCLEX is testing you about best direction, NCLEX is telling you, think about that the statement must have task, the condition, and the task must not be vague. The task must be specific. So instead of using ADL, this is vague. NCLEX wants you to just specify bathing or maybe dressing, right? Or maybe feeding, That's what the NCLEX wants you to use. So if it is best direction, it always comes in the form of statement. So the NCLEX wants that statement to include the patient condition, the task, and the task must not be vague. That's how you answer best direction. But this is an example of assignment. And how do you know? Remember, I taught you about structure, right? So your structure is all about the body, the stem, then the answer key. The body is telling you right here that we are dealing with assign. If it's not assigned right here, the NCLEX is going to put best direction. So the examiner will tell you what to do. But in this case, we are dealing with assign. So assign wants you to deal with task, loss, stable, right? Now, first thing I need to deal with is the task. So what's the task? Assisting to shower, checking the ability to swallow, observing the client, transporting, right, the client. Now, can the UAP assist the client to shower? Yes. Can they check the ability to swallow? No. So this is out. Can they observe the client? No, this is out. Can they transport? Yes. So now, based on the task, I have 1 and 4 as my answer. So now I'm not going to look at the patient, if the patient is stable. So now, since I'm dealing with number 1 and 4, I need to look at what is the condition. Atrial fib, respiratory distress. So a patient that is having airway or breathing problem over a patient that is having circulation problem, or is stable. Obviously, this is unstable, this is stable. So now 1 is the answer, simple. Right, that will help you not to overthink, because a lot of students, I see them, they will be like, assisting atrial fib. I don't know if this patient is atrial fib. They will be like, they will spend like 1 minute here. What is this condition? I don't know what this is all about. But now I don't have to think about this, because I've eliminated this because of the ability to swallow, they said, checking they are not UAP related. So stop overthinking, focus on principle of answering question, and that will help you out. Now, this is an example of a patient that is not stable. Now, you can see the NCLEX is asking for intervention. They talk about plan of care. They did not stop at multiple sclerosis this time around. Instead, they include astasia. Now, this is an example of a patient that the NCLEX is directly telling you that they are not stable. So now we are trying to care for what? The astasia. We are not trying to care for the multiple sclerosis. Hope you are listening to me. Right, focus. We are not trying to care for the multiple sclerosis. We are caring for astasia. It's the astasia that is the problem. That's why the NCLEX is telling you astasia. All right. Now, so I'm looking for intervention related to astasia. The only reason why you don't understand this question is because, remember I said earlier on that the NCLEX tests you on what? On medical terminology. So you need to know your medical terminology. So when you are learning about different body system intervention, you need to learn terminology alongside with it. But now let me still share you a secret on how you can know what is going on, because there's always a secret. It's not really a secret, it's nursing principle, right? But you can find out. Right. Let us say you don't know what is astasia. Now let's focus. Now, one thing you need to know is that this question is not a select or apply question. So it's going to be one answer. So now focus on how I'm going to get what is astasia. Let us say I don't know what is astasia. Now, but I need to know the intervention because I've studied so much about intervention. So I know when we use ticking diet. We use ticking diet when the patient is at risk for what? Aspiration. So this is not aspiration because if it's aspiration, then we put aspiration here. So I believe the answer will never be this. Now, physical therapists, we use it when patients have maybe movement issue, coordination, muscle problem, bone problem, all those kind of things. So yeah, I don't know what it is because this is not telling me a clear answer if that is related to astasia. So I'm going to keep. Now, face the client directly to speak with them. This is a client that have issue with hearing. Right. I don't know whether it's related to astasia because I don't know. I'm going to keep it as well too. Now, provide the client, but this is hearing and communication, right? Or let us just say communication. Right. Providing a board with a picture for the client communication need. This is also related to what? Complication. Now, it's not possible for two answers to be in this question because this is a communication thing, this is a communication thing. Speaking, communication need. So definitely I know this is out. I've eliminated this one and 2 is left. So obviously I will accept that the answer is number 2. But if you have knowledge about the question, right, you can easily believe that yes, astasia is an issue with coordination. Now, if you are looking for an answer to fix coordination, now when you have a problem, it's very easy to answer your question. This is astasia. This problem is issue with movement, coordination. The NCLEX is asking you for intervention to fix this. So are you going to select aspiration? No, because aspiration and movement is not the same. Physical therapists, yes, they fix this. So likely answer. Speaking is not related to astasia. Speaking is communication, anything. But this is movement and coordination issue. This is also communication. This is movement. So which answer fix movement? Obviously number 2. Clear. Yes. That's how the NCLEX work. Trying to see real quick. Now, look at this particular question. Now, remember I said something about knowing your category. Now, the principle of safety and infection control, which we know the principle of infection control. Infection control is what? Safety before treatment. Now, if I don't even know what this question is all about, when I read this option, right, I want to know because we are planning care, we are giving intervention, we are not trying to treat. When you are doing intervention, you are not really trying. When you are doing plan of care, you are not trying to treat. Now, keeping the patient MPO, using this, that is a form of maybe doing something related to this. So, using that, understanding that concept, you can tell that number 4 is the answer. But if you don't really understand what is plan of care, right, then let me show you another way. Now, this is a safety and infection control question, right? Infection control. Now, infection says you should do safety before treatment. So now when I notice that the NCLEX use droplet precaution, I can easily tell that NCLEX is not stupid for adding implement droplet precaution. It means that this question is 100% an infection control question. Even if I don't know what P26 means, I know that this is an infection control question because the NCLEX are sold out what that means. And the principle of infection control is safety before treatment. So this will definitely be my answer because this is the safe thing to do when you are dealing with infection. You must prevent everybody, other clients and staff member from having that infection. So this is the key before you even think about doing this. So that's the answer right there. Easy. If you understand concept, you don't need to think about a lot of questions. You'll be able to answer it easily. So utilize all these things. NCLEX repeat all these concepts. The question might be different, but the concept don't change. The concept don't change. So know that. The concept don't change. Now look at this particular question. Now let's try to figure it out together. Now let us add that I don't know what this is all about in pedigree. That's what I don't know, but the NCLEX has sold it out that we are doing infection control. So there's no need for me to look at the option to figure it out whether it's an infection control question. The NCLEX has already directly said we are doing infection control. Now, infection control, when we are dealing with infection control, we have standard and transmission based. Standard, we don't know what infection we are dealing with, but obviously the NCLEX gave us a certain infection, so this is going to be transmission based. And when you are thinking about transmission based, you are thinking about airborne droplet contact. Now, surgical mask, when bathing, it means that we are thinking about droplets. Gown, when changing bed lining, it means that we are thinking about contact. Keep the door closed right? It means that we're thinking about airborne. Clean glove, it means that we're thinking about contact. Surgical mask when transporting client, it means that we're thinking about airborne or droplet. Because it's only airborne or droplet we use surgical mask when transporting client. Right. Now, remember this is a select order apply answer. So if your answer will be airborne, if this condition is airborne, then all our answer will be airborne, airborne, airborne. If this condition is droplet, all our answer will be droplet, droplet, droplet. If this condition is contact, all our answer will be contact, contact, contact. Now, I'm seeing droplet here, droplet here. I'm seeing airborne here, airborne here. But if I want to select this answer, meaning I need to select 1, 3, 5. But it will not go with each other because this is droplet airborne and this is airborne droplet. Everything must either be airborne, airborne, airborne. So because they are not related, I can easily believe that this is not the answer. But the answer is 2 and 4. Now let's review the infection. The infection is impetigo. So what is impetigo? Impetigo is a skin infection. So now, since impetigo is a skin infection, so tell me now, what answer will be related to skin infection? Obviously, this is not related to skin. This, yes, is related. This is not related to skin. This, yes, is related. This is not related to skin. So 2 and 4. So even if you don't know your infection, if you know the precaution, you can still get to know the infection. So for students that always used to say, oh, I don't know most of the infection, so I struggle with it. You must know one of the two. If you don't know the infection, know the precaution. The precaution will reveal what the infection is all about because you need to understand the principle of answering the question. Right. So NCLEX is not difficult. You just need somebody to help you out in your thinking so that you can be able to come out with the answer. Same thing. Take for instance, we don't even know this is what tuberculosis. Right. Take for instance, we don't know what is tuberculosis. Airborne droplet is respiratory, contact is skin. Right. Now, the NCLEX is asking us for infection control again about tuberculosis. Right. So now they said we should wash our hand. Wash our hand is not related to airborne droplet and contact. That is standard precaution. So wrong. Now, mask gown, this is contact. Tissue, this is airborne or droplet. Put clean mask. We don't do this. We don't tell patients to use masks while they're in their private room. We tell them to use tissue. So this as well too is wrong. Wrong. So we are left with 2 and 3. Now I'm in between 2 and 3. This is not a select or apply answer. This is what? One single answer. Now I want to differentiate if it is contact we are dealing with or airborne. Now look at the hint right here. The NCLEX is talking about pulmonary. Pulmonary is only related to airborne or droplets because that's respiratory, right? Contact, you get it from touching, surface, body fluid, but airborne, you get it from sneezing, coughing. And this is related to pulmonary. Even if I don't know what TB is all about, I know what pulmonary is all about. So it makes sense that the answer cannot be 2. It will be 3 because this is related to airborne, which is respiratory. And then you say your answer is 3. Smart. So there's no issue with saying, oh, you are trying to answer a certain question and you don't know what the infection is all about. That's why I used to tell students, you can pass safety and infection control 100%. You don't just know how yet. But when you know how, you understand it. Now, let me do the last aspect of
Something or something, stir. Yeah. I won't take.
last aspect of communication.
Yeah. That's not for you, that's for my name.
Get away from it.
Yeah.
Why don't we go plan for the outside then?
No,
Of the inside one?
that's for the name.
You want to have we might be waiting.
This is for a girl lady. You make the next. 12.
Well,
So you're not 10, because you got white skin. Yeah. But you think you're okay with that? What size is your foot? That's 11:45. So you're at 12.
Maybe can't find it all.
You got white feet. White feet. No, 6 to 3. I got these. Right.
Down to make it right.
Your mom.
Oh, look out for the baby.
You have. And that's, right.
So I want to teach you the principle of communication. Last thing. Now, communication question is very easy. When you see a communication question, just know it. The NCLEX is asking for therapeutic answer. But how do you know if it's a therapeutic communication question? Now, if the question is filled with emotion, it's a therapeutic communication question. Or if the NCLEX is talking about maybe the NCLEX is saying the nurse and somebody is having discussion and they put the patient or client statement in quotation like this, it's a therapeutic communication question. Take note of that because that's the secret. I've given 3 secrets right here. So when you see questions like this, they are bonus on the NCLEX exam. Now, when I read this question, they said the nurse is caring for a client who has been told they have cancer. The nurse enters the room crying. That's emotion right there. So I don't need to think twice. The NCLEX is testing me on therapeutic communication. And look at it right here. Which of the following response is appropriate for the nurse to make? Now, when you are making therapeutic communication, it must be based on what the patient is feeling and the patient only. That's just what you need to think about. You seem upset. May I sit for you a while? That is thinking about the patient. Let's keep it for now. I will give you some time alone. We don't leave the patient to themselves. No, that's wrong. I can telephone. We don't do it. We want to focus on the patient. So that's wrong. Telephoning the family member, no. We want to focus on the patient. Do you know is a spiritual advisor? We want to focus on the patient. So all those answers that is related to family, spiritual advisor, that's not the first thing. You are dealing with the patient themselves. So number 1 is the answer. That's how NCLEX wants you to think. The patient themselves before any other thing. Now, let me show another question. Now, if you look at this particular question, it has quotation of what the patient has said. 100% is a therapeutic communication question. You might find out, you might ask, but the question have something related to CBC, urinary disease, X-ray. Why is it now therapeutic communication? You might be thinking about all those things, but now you know the secret. When there's a quotation about a patient statement, the NCLEX is asking you for therapeutic communication. Now, the test will not take so long. That is not talking about the patient concern. So wrong. The tests are part of admission. That's not talking about the patient statement. That's wrong. It must be difficult to understand. Yes, this is talking about. Yes, that's correct. Perhaps you need to discuss. We don't send the patient to another area. So yeah, that's the answer. I'm just trying to rush through this so that I can be able to end the video, end the session. They all work like that. So if you see communication question on the NCLEX exam, that's how you should approach it. If you see those 2 things, yes, that's a therapeutic communication question. You'll be able to answer it like that. This is how NCLEX tests nursing process. For people that don't know nursing process, I've seen a lot of students, they will say, oh, the assessment has already been done. How do you know that the assessment has been done? Some people will be saying a different thing. Now, look at this particular question right here. Right. They said, how do you know it's a nursing process? NCLEX use either
Can you please make it a little bit bigger?
How do you know that the NCLEX is testing nursing process? Is either they use the keyword nurse or what? First. But nurse is definitely a nursing process. First can either be it's a nursing process or we are trying to take a certain step for a procedure. But we are dealing with a disease condition, so it's definitely going to be a nursing process. If we are dealing maybe with urinary catheter or maybe fixing a certain kind of procedure, then it will be step. So everything is all coming to deal with nursing process. So this is a nursing process question. Right, and the NCLEX is saying the nurse is collecting data. That collecting data already is already telling you we are in the phase of what? Assessment. Now, the nurse observe an irregular area. Right, the keyword right here is that the nurse observe. NCLEX don't like observation. NCLEX don't like subjective data. NCLEX like objective data. Print this into yourself. Right, objective data. So now there's no objective data here. So assessment has not been completed. So a lot of students will say, oh, the patient has been, the nurse observe. NCLEX observation, you cannot tell somebody, but I observe the patient having difficulty in breathing. If that patient, let us say now, the patient have shortness of breath. Maybe 30 minutes later, the patient now die. Now, they now call you, nurse ABC. What happened to the patient? You say, I observed the patient having shortness of breath. Okay, so, but I'm not seeing any place in the vital sign that you tell us about the respiratory rate, the oxygen saturation. You are going to explain, lose your license, then it's a problem. So NCLEX don't deal with observation. That's not a proper way of assessment. NCLEX deal with objective data. What's the objective data that is really telling you that this what you are saying is accurate? You need that objective data to show it. That's what the NCLEX is all about. So since the objective data is missing, right? So assessment has not been done. So all I just need to look at is which of the following is an assessment answer, right? Because if assessment has not been done, you cannot move to diagnosis, planning, intervention, evaluation, because this is a nursing process question. Some people don't know it's a nursing process question, so they will think through this disease condition, but the NCLEX is not even testing you anything about this disease condition. The NCLEX is just testing you on the process of nursing process, is the concept, right? Now, determine whether this finding is normal. This is a form of assessment. Asking the patient to show the tendency of bleeding. This is a form of diagnosis. Reporting, this is a form of intervention. Applying, this is a form of intervention. So the first one is diagnosis. The second two is intervention. This is the only one that is assessment answer. So 1 is the answer. I'm so sorry I'm rushing through. I just want to finish the class.
I have a
So-
question.
Okay, ask me.
How do you recognize objectives and differentiating objective information from subjective?
All right. Subjective information. Where do you get subjective information? Obviously from the patient, the family member, any other person different from the nurse.
Okay.
Right. That is subjective information. But objective information, nurse can only give that information. And they are information that they are what? Measurable. So there's nothing that we can measure here. Measurable, such as maybe lab, vital sign, those are things that we can measure. So right here, nothing like that is measurable. Irregular area, it's based on observation. Now, if maybe they say something like, okay, the area was measured 2 centimeters, this is measurable, right? You can easily tell that, yes, the nurse really observe what they said was observed, because she measured it and she saw that it is 2 centimeters, maybe wide, deep. That's the assessment. We've done wound dressing assessment before. Now these are things that occur, and these look like they are talking about a certain kind of wound or something like that. So there's no objective data that is telling us that yes, that is really true, right? So we need to find out. Right, so you just need to look at your answer. Let me go through the answer slowly so we understand. Now, they said determine whether this finding is normal. You can see now the number 1 is talking about this finding. So you can see now this option is saying we should determine if it is normal. This is trying to find out an assessment. There are some certain observations we cannot even measure it. We just try to determine whether it's normal or not. Maybe it's something. So yeah, this one is an assessment answer. Now, because we need furthermore assessment. Now, ask the client parent whether the child has shown tendency of bleeding. Why is the nurse thinking about bleeding? It means that the nurse know what is going on. So the ability to know what is going on is a form of you've done diagnosis already. So we are not in the phase of diagnosis, so we are not selecting any answer related to diagnosis. So this is out. If you notice, the nurse is not sure, that's why she's trying to find out things. But if the nurse is thinking about bleeding, it means the nurse is sure of what is going on. She's trying to find that issue related to the diagnosis she's thinking about. We're in the phase of assessment, so no assessment and diagnosis answer. Now, report the finding. This is a form of intervention. Apply gentle pressure. This is a form of intervention. We are looking for assessment answer, so this is it. So people that don't understand the concept will be thinking about each option. That's what I know for sure. They will start to try to remember what they know about this in order to find the answer, and they'll be lost. But NCLEX test concept, and the concept right here is collection of data and what would you do next. Simple. The NCLEX is not asking you about gastroenteritis or treatment. Now, look at this particular question. Now, a lot of people that have problem with maternity will say, oh, I don't know a lot of things about maternity. Now, look at this keyword right here, express concern. Express concern, therapeutic response. This is a therapeutic response question. Some people will say, oh, the patient is unable to roll over. They will start to be thinking, when should a baby be able to roll over? The NCLEX is not asking you about that. The NCLEX is asking, this is an emotion right here. It means the NCLEX is testing you for therapeutic response. Now, what is the therapeutic response? We should inform the child primary health care provider, no. we are trying to do something for the patient. Remember, first, as a nurse, most child are able to roll. Yeah, this look like an answer. Let's keep it. Does your infant smile? This is not a therapeutic response. No. Is your infant able to pick? No. This is the therapeutic response right here. True. Therapeutic response don't ask question to a certain problem. We make the patient feel comfortable first. That's what we try to do. It seems you are feeling sad. Should I sit with you? We don't start saying, what's this, that. No. Therapeutic response. Right, look at this particular question. I'm answering this particular question because a lot of students that feel they need to know every disease. Now, let's take for instance, I don't know what this is all about. Now, they say we are reinforcing teaching. Now, the principle I'm using to answer this question is teaching, not this. I know there's a problem. So, teaching, as I said before, you need the problem plus solution. So, what's the problem? I'll make sure my child bathes after outside. So, now I'm trying to say, okay, this question is related to infection because looking at everything is related to infection. Now, they are saying, I need to bathe. They are saying, I will make sure my child bathes outside. So I'm trying to say, okay, if this is an infection, because obviously they are talking about prevention and it's showing sign of infection. I'm trying to say this particular disease, the parent is saying they get it from not bathing. So I'm going to say not bathing. Now, I will keep my child away from other child. What the parent is trying to say, they get it from what? Other children. Now, keep that. This is talking about boiling food or something like that. It's trying to say they get infection from food. Now, this is saying they wear long sleeve from wood. Maybe they get it from being outside in wooden area. Now, understanding this, I don't really know what's really the answer now. But now, one is talking about not bathing. One is talking about getting it from another side. One is talking about food. One is talking about wooden area. Now, let me now show you how to know what the answer is talking about. Now, I will make sure my child wear long sleeve and pants. Now, what the NCLEX is testing is teaching related to what? Prevention, not really this. The NCLEX is trying to find out, do you know if the answers have something related to prevention? Now, this is saying I will make sure they wear long pants, wooden area. So we know where they are getting it and we know what we are trying to prevent it. This is saying I will ensure potatoes kept, but we don't know how this is causing the infection. This is just saying food, but what are we trying to do to the food? We don't really know. The cleansed child, I will keep child away from child. Now, 4 and 2 is your likely think area. I will make sure my child bathes after being outside. If you are trying to prevent something, you don't necessarily need to go outside, get the infection before you come and prevent yourself. Instead, you will prevent yourself before you go outside. So saying, I will make sure my child go outside, and we are thinking about prevention. Prevention is trying to avoid something. So saying I will bathe when my child come outside is not prevention because they are already exposed to what they need to be exposed already. So coming back, they are bringing it already. So bathing might not solve it. So this is wrong. So now these two are definitely wrong. You are left with 2 and 4. Now, this is where thinking might come in place. Now, if the number 2 is saying you should protect your child from other client that other child that have Lyme disease, right? But the thing that you are going to think about here is prevention. Now, in order to prevent, right, the key right here is that we are saying we are protecting our child from other child. Now, the question is, how do we know other child that have Lyme disease? Is it possible to know that child that have Lyme disease? No, it's not possible to know. So is this a safe way of preventing? No. But this number 4 option is trying to tell us that the parents understand that they get it from wooden area if they don't put it on this. So now, if they are going to go to the wooden area, the parent is saying they need to wear this to play in the wooden area. Unlike this one that is saying they need to firstly go outside before they come back to bathe. This number 4 is saying they will wear this to protect themselves before they even go. So this is a form of prevention. Your answer is number 4. Sorry, I'm rushing through it, but yeah, that's just the concept of prevention. The NCLEX is testing on prevention, not really Lyme disease. So if you understand principle of prevention, you'll be able to answer the question even if you don't know what Lyme disease is all about. I'm trying to look for if there's any communication question. All right, you can see this communication question has quotation. So this is a therapeutic response, right? Therapeutic communication. So you just need to select therapeutic communication. I need to tell you that you cannot talk about silly things here. We don't insult our patient. Why do you think we don't ask why question? I'm listening here to listen to your concern. Listen to your concern. That is because now this statement is talking about something that is wrong. I'm here to listen to your concern, right? Okay. How does it feel to be back? I'm here to listen to your concern. How does it feel to be back? All right. So the answer to this one is 3. Right. So the answer to this one is 3. How does it feel to be back? Is reinforcing this wrong statement from the patient with schizophrenia. So obviously the answer is 3. I'm here to listen to your concern. Right. We are not trying to reinforce anything. We are just trying to give therapeutic communication. So more therapeutic communication is number 3. Number 3. Now, this particular question as well, to the particular student that answered this question gave me a lot of problem because she was like, oh, but the patient is having this, the patient is this, the patient is that, the patient. Anytime your question just have quotation like this, it is testing you on therapeutic response. That's what the NCLEX is asking you. The NCLEX is not asking you for treatment, they're asking you for therapeutic response. And the therapeutic response is the type of care that you have undertaken is not easy. Right, because the student was like, oh, but the patient is having this and they said they have redness. Why not we ask them how long do you? No, that's not what the NCLEX is asking you. Yes, the NCLEX is saying you can do all this because the keyword is talking about an issue. Right, but we are dealing with therapeutic response. Therapeutic response tell you to make the patient feel comfortable first before care. Therapeutic response don't have anything to do with treatment or asking for that question. The therapeutic response is just to make the patient what? Comfortable. Response. Right. So yeah, and with that being said, I feel the information I've really given so far so good. The aspect of nursing process, caring when it comes to your acute, chronic condition, teaching, communication, out of and I've given you clinical judgment. So this 1, 2, 3, 4, 5. The only thing I've missed out is culture and spirituality. So if you apply those concepts that I've given you, you will see every NCLEX exam question and you are going to kill it. The only thing you just need to do is to understand basic care. Your basic care is that you need to know your vital sign. NCLEX is not going to give you normal range for vital sign. NCLEX can give you normal range for labs, but not for vital sign. NCLEX believe you need to know vital sign. On the NCLEX exam, you need to know vital sign for peds and adult. Right, lab, right? Head-to-toe assessment. You need to know head-to-toe assessment. How do you assess the neuro? Like you have 10 body system, you need to know the 10 body system. And you also need to know them in level of priority. Neuro is first, followed by cardiovascular, respiratory. Don't ask me. Just know this. Right, neuro, cardiovascular, respiratory. For people that like to use ABC, they might say airway, breathing, circulation. According to the NCLEX, neuro is priority because if neuro is having problem, all this will not even exist in the first place. Right. So if cardiovascular is having problem, even the neuro and respiratory will not exist. But NCLEX will not give you confusion. NCLEX will not give you a cardiovascular problem and as well airway problem in one question. No, it's either airway will be the problem or cardiovascular. That's the reason why I wish to tell students avoid ABC and focus on CNR. NCLEX use CNR, cardiovascular, neurological, respiratory. Right, for your prioritization. And never prioritize with the patient diagnosis, prioritize with what they are experiencing. Now, you need to know the principle of complication, right? Complication in each body system, and you need to know the intervention associated with each body system. Only this 1, 2, 3, 4, 5, 6. You'll be able to answer NCLEX caring question. Culture and spirituality is very simple. Anytime the NCLEX is telling you about a patient culture, even if you don't know about that culture, apply it to their care. Their spiritual aspect, don't question it, apply it to their care. So with that being said, this is the end of the lecture. And with everything I've given so far, if you
I have a question.
ask me, please.
So the answer to this one is number 1.
What's your answer? What's your answer? The answer is number 2.
Oh, okay.
Mm. Yeah, the answer is 2. So far, so good. What I've given so far, if you can utilize it, I am 100% sure you are going to pass in 85 questions. So there's 2 ways you can do it. Right. You need to understand the NCLEX so that you can be able to pass the NCLEX exam. So yeah, I wish you all the best. Right. If you have any question, you can reach out to me. Right.
Thank you.
Eh,
17676130769. If you have any question, reach out to me directly. Right. I can be able to answer your question. Right. So yes, that is it about everything you need to know about the NCLEX. NCLEX is all about concepts. NCLEX is not about general knowledge. If you use general knowledge, yes, you can pass, but it's going to be difficult, stressful, pain, tears, pressure, fear, anxiety. But if you learn the concept is, I'm not teaching you my concept. It's the NCLEX concept. It is right here on your test plan. Right. This is what the NCLEX is testing you. Look at the concept right here. Look at what the NCLEX is saying. You should know psychologist, sociology, anatomy, physiology, biology, microbiology, chemistry, physics. That's what the NCLEX is asking. Now, these are the concepts right here. So they are not my concept. They are the NCLEX concept. I'm only just trying to break it down for you. Right, so you know. And people that want to study, they should study according to the test plan. Right. Some people study wrongly, right? You don't know that these are the most important area on the exam. These are the most important area on the exam. These 5 area will give you 79% of the exam. Is it 79? Oh, 73. This is 27%. 27% of the exam. So if this is what you are focusing on, most especially people that wishes to say, oh, I have problem with maternity. Maternity is part of this 9%. So if you are focusing on only maternity, you can fail. That's the main reason why you have problem you have below. Or pharmacology that you don't want to touch, you have below. Now, when you have short of 16% and 18%, what's left for you? 14, 12, 13, 15, 25 plus 14. That is 39. Can you pass with 39% on the exam? Obviously, that's the reason why a lot of people fail. Right. So if you are looking for the content to study for the NCLEX exam, yeah, obviously just check through the document as well too. There's all the content right here. Right here. For management of care, this is what you need to study. For safety and infection control, this is it right here. Health promotion. There's no once you go on the NCLEX exam, you are going to see this content right there on the NCLEX exam. Right. You will see it. Now, this is the knowledge statement as well to that show you what is going to be on the NCLEX exam as well too. These are the knowledge statements, right? They are well arranged right here, but I like using that one because it showed me the high priority or high yield area on the NCLEX exam. 338 content for RN, 280 for PN, and everything are right here. What the NCLEX will test. If you have taken the NCLEX exam before, just go through this knowledge statement and you are going to be shocked that you got questions from all these areas. Right. So with that being said, this is the end of the session. Any question, please?
Thank you.
All right. Good night.
Thank you. Good night.
Good night.